Join us at the 2025 ASCO Gastrointestinal Cancer Symposium from January 23rd through 25th in San Francisco or online. Learn the latest innovative science and solution-focused strategies and make connections in the global GI cancer community. Register at gi.asco.org today.
Hello, and welcome to the ASCO Daily News Podcast. I'm Dr. Fumiko Chino, an assistant professor in radiation oncology at the MD Anderson Cancer Center. On today's episode, we'll be highlighting key research and compelling perspectives that were featured at the 2024 ASCO Quality Care Symposium. I was delighted to serve as the chair-elect of this meeting's program committee, and I'm overjoyed to welcome its chair, Dr. Raymond Osarogiagbon, to the podcast today. Dr. O is the chief scientist at the Baptist Memorial Health Care Corporation and the director of the Multidisciplinary Thoracic Oncology program at the Baptist Cancer Center in Memphis, Tennessee. Our full disclosures are available in the transcript of this episode, and we've already agreed to go by our first names for this podcast today. Ray, it's so great to speak with you today.
Thank you, Dr. Chino, and thank you for letting me call you by your first name, Fumiko.
I think both of our names are complicated enough, and so I appreciate the level of familiarity that we've had with each other during the planning process for this fantastic meeting. Now, the Quality Care Symposium featured some really compelling research on very timely topics that address a wide range of issues in cancer care, including quality, safety, equity, supportive care, survivorship, and technology and innovation. Wow, what a lot to cover. Ray, do you mind sharing with me some of the key sessions that really stood out for you?
Yeah, Fumiko, this was such a great conference. Our tagline this year was driving solutions, implementing change. We had more than 700 attendees in person and virtually. The symposium featured many fantastic speakers, oral abstracts, posters. We had networking opportunities for junior colleagues to interact with leaders in the space. We had conversations that will surely inspire future collaborations to improve quality cancer care. We had patients, advocates. I was inspired by the patient perspectives that were presented, learned a lot. And I really felt like this enhanced our understanding of some of the key issues that we see in our clinics. I was honored to be able to introduce my dear friend, Dr. Ethan Bash from the University of North Carolina at Chapel Hill, who received the Joseph Simon Quality Award this year. Dr. Bash gave a talk titled On the Verge of a Golden Age in Quality Cancer Care. In that talk, which received a standing ovation, by the way, he tracked his personal development from fellowship training at Memorial Sloan Kettering, then through a junior faculty position at the same institution under the mentorship of Dr. Deborah Schrag, and ultimately to his current position as chair of oncology at the University of North Carolina and as physician-in-chief at North Carolina Hospital. In parallel with the evolution of the patient-reported outcomes movement that he has been right at the heart of, and also the evolution of cancer care delivery research into its current position of prominence in oncology. That was a spectacular talk, and it rightly received a standing ovation. We also had presentations and panel discussions that addressed patient navigation in cancer care, moving from theory to practice, which provided just wonderful, diverse perspectives on the evidence-based approaches to patient navigation in cancer care, and also a wonderful session on the complexities of a pharmaceutical supply chain, what everyone in oncology should know, that talked about, the current challenges in the pharmaceutical supply chain, leveraging technology to support patient-centered multidisciplinary care. We talked about health-related social needs and the impact of diversity, equity, and inclusion on the oncology workforce. Talked about research around all of this, patient care perspectives, just incredible. So Fumiko, as an equity researcher, I really want to hear your key takeaways from some of these discussions.
I have to say, I was so impressed with not just the science that was presented, but also the passion from some of our educational speakers who are really speaking from their expertise and their commitment to try to continue to advance equity in the field of cancer care. And as someone who is still a relatively junior researcher, I feel that the work that I've done over the last decade has really been built on the shoulders of these giants. Just, harkening back to, you had mentioned that Dr. Bosch essentially gave an overview of his career as a young health services researcher. I've been really impressed about how generous the leaders in the field have been with their time, not only to discuss their research at this conference, but also to talk to trainees and fellows and junior researchers. In terms of equity research presented at the conference, though, I was really struck by the overview we were able to provide about the best care to provide to LGBTQ patients. Dr. Mandy Pratt-Chapman actually gave a really lovely overview that was always centered in the patient, but it really taught me a lot about what the best practices to not just collect SOGI data to improve research, but also that there's billing codes that can actually help decrease the chance that a patient may be misbilled based on anatomical misunderstanding of their gender identity. I was very impressed about the capacity for some of our researchers to really think outside of the classic box for DEI research. So not just race as a social construct, ethnicity, but also health literacy barriers. There was a fantastic analysis looking at a randomized controlled trial that actually showed that patients with low health literacy actually got the most benefit from a digital intervention that involved text remindings to increase adherence. And the flip side of health literacy is that we know that the specific interventions that we do really do need to be explicitly designed for the populations that they will be implemented on. Dr. Locante actually had the results from her intervention looking at radon mitigation indigenous communities. And I was so impressed about her commitment to the process of listening to the communities and what their needs were, what their concerns were, and then implementing this community-led intervention that helped mitigate the radon risk from many households where the actual radon levels were surprisingly high beyond what they were anticipating. And so it's all of these manifestations of how do we actually improve research, how do we advance the field and further their conversation in an era when it seems like DEI is really under attack. Well, I know you've been a long advocate for equity for lung cancer, and I know that you were actually involved in one of the amazing science being presented that was essentially a decade-long QI project to try to improve standards of care for lung cancer in a high-risk community in the Mississippi Delta. And that actually showed over time that this surgical pathology intervention actually was able to improve overall survival for lung cancer. I know that this was part of work that you've been doing for years. Can you talk a little bit about what was presented within the symposium specifically for lung cancer, including your study?
Yeah, Dr. Fumiko, this was one of those, heart-gladdening things. The member of my team, Wale Akimbobola, who has an MPH that he actually acquired within my research team, I'm proud to say, he had the wonderful opportunity to present this work that we have done implementing surgical quality improvement and in parallel pathology quality improvement in a well-defined population involving 14 hospitals in 7 healthcare systems across 5 contiguous hospital referral regions in Mississippi, Arkansas, Tennessee, at the heart of the Mississippi Delta region. So Wale showed that over the course of 4 consecutive 5-year time spans, the quality of surgery has improved from a time when using current objective benchmarks of surgical quality, anywhere from 0 to 5% of resections met these current standards. So basically applying today's standards, but retrospectively, to where as the interventions took hold, we now got to a point where about 67% of resections in this population now attain surgical quality. And we saw in sequential lockstep with that the hazard of death among these patients has significantly gone down all the way. I think using the first 5 years as the reference, the hazard were reduced about, 64%. Really amazing to see. But, there were other things, though. I mean, yes, lung cancer, but, there was this randomized controlled trial that demonstrated that olanzapine therapy was actually way more effective than prochlorperazine for patients with intractable chemotherapy-induced nausea and vomiting. I found that very compelling abstract. And then there was Elise Park's tobacco control intervention, remotely administered using technology, that was actually presented in today's session, talking about leveraging technology to enhance multidisciplinary care delivery. That too was amazing to behold.
I've been so impressed within at least my interactions with the Quality Care Symposium for the last several years about how this meeting really creates the perfect space for this type of science, which can be frankly underappreciated at other meetings. And something like a QI project, a quality improvement project leading to an overall survival benefit, or a trial, like you mentioned, the randomized control trial for olanzapine, which specifically had a quality of life endpoint, meaning that patient quality of life was a compelling justification for optimal nausea control. These things are really underappreciated sometimes at the larger scientific meetings, and the ASCO Quality Care Symposium is really where these types of studies and this type of research really shines. It's very patient-centered. You mentioned the patient voice being a really integral part, and I certainly agree with that. The entire meeting session started with a phenomenal patient advocate, Jamil Rivers, who was diagnosed with de novo stage 4 metastatic breast cancer. And her experience with her primary treatment really highlighted some of the care gaps that Black women experience in their journey with breast cancer. And it really charged her actually create a patient navigation company an organization to actually help Black women with breast cancer get more evidence-based care, to make sure that they were actually asking the questions that needed to be asked, getting the resources that they qualified for, and making sure they were getting evidence-based care. Now, shifting gears a little bit, in oncology and across medicine, there's actually been some major challenges with drug shortages. I'd like to ask you about the session that was featured to inform oncologists about what we need to know about navigating the complexities of the pharmaceutical supply chain. Do you mind sharing highlights from that discussion, Ray?
I will, Fumiko. But before I do that, I got to follow up with what you said about Jamil Rivers, this breast cancer survivor and advocate who leads the Chrysalis Initiative. She made the statement of the meeting for me when she said, a hospital encounter for a Black woman is like a Black man being pulled over by the police. Wow. I mean, that's a direct quote. I went back to her and said, could you please say that again so I don't misquote you? Because you know what it did? It suddenly helped me understand my wife's many years long anxiety whenever she has to encounters with clinicians. Wow. Talk about learning something that comes right home. But about that wonderful session on the challenges with the pharmaceutical supply chain, for me, there were two key highlights. One was Dr. Deborah Patt's discussion of the growing influence of pharmacy benefit managers, PBMs, on the cost and delivery of cancer care. And then there's Jason Weston's discussion of how the U.S. generic oncology drug manufacturing has moved almost entirely out of the U.S. with this incredible, unrealistic price focus, almost so focused on price competition, almost totally ignoring quality and safety. And paradoxically, that fierce competition has inhibited competition, right? So as the margins have shrunken and all these manufacturers, generic drug manufacturers, have moved overseas with little oversight, the supply chain gets disrupted because these companies are not able to invest in processes in their manufacturing facilities and so on. So when something goes wrong, all of us become vulnerable. And this other striking thing I learned from Jason was this problem is not new. It is not new. It's been with us for decades. And without comprehensive solutions, unfortunately, it's not going to go away. These are some of the examples of things that I would really love the podcast audience to go and check out for themselves.
I will just highlight one additional aspect of that session, which was actually the oral abstract that was embedded into the session that was specifically about how when during the cisplatin shortage of last year, when that drug was out of stock, which is honestly a very widely available, typically cheap medication, Dr. Jody Gary actually presented on the fact that the things that were substituted were actually far more expensive. And that actually led to not just people not getting the standard of care due to the drug shortages, but also increased costs. So the bizarre side effect of the race to the bottom in terms of price competition is the fact that during these shortage periods, there's actually a sharp increase in the overall cost, not just to the administration, but also in terms of payer costs and patient cost sharing. So it is sort of a lose-lose situation. And that was really highlighted to me by that abstract. And I'm so grateful for the research that really puts these experiences that we see in our clinic, things like drug shortages, in a larger perspective of how things like health policy and reimbursement and some of the nitty-gritty that goes on beyond the scenes in terms of oncology practice really is ending up impacting patient care. Now, Ray, is there anything else you'd like to highlight before we wrap up the podcast?
One I maybe should highlight was the discussion about DEI that we had, which is obviously a contentious topic. And we had Dr. Johnson with the American Cancer Society tell us how DEI has evolved from something that everybody seemed like they were eager to support, champion in 2020 to where the backlash has kind of how we moved from $5 billion in pledges by corporations to support DEI initiatives in 2020 after the George Floyd murder to now where everybody is wanting to roll things back. And yet, in the face of this, wanting to roll things back, wanting to respond to an inevitable backlash, there's these commitments still that some companies have had to the DEI and workforce development ideas. So nevertheless, ongoing support. For me, that was a bright spot.
I have to say, as someone who started going to ASCO Quality as a trainee, I've been really encouraged myself, in terms of bright spots for this meeting about the engagement from trainees, from medical students to residents and fellows to early faculty. We even had someone who had just graduated high school ask us one of the questions in a session. And that really highlighted for me that this meeting is a very young meeting. It really is the next generation of health services researchers. And that has always been one of the joys about some of the discussions, because I feel like the science presented, the education presented is sparking new collaborations, new research paradigms, new mission-driven research for a whole nother generation. And it's been just simply phenomenal.
Yeah, the networking opportunities. Wow. It was such a joy to behold people getting together, breaking off in small clusters, interacting with each other, strangers meeting and hitting it off. I mean, just what a wonderful meeting this is.
Yeah, I have to highlight that I certainly know at my first ASCO quality meeting at this point, it's been, I think, 8 years ago, I went to one of those Meet the Expert luncheons, had a great conversation with a phenomenal researcher who I still obviously very much admire. And I was sitting at a table at a Meet the Expert luncheon today, and I just felt so invigorated by some of the conversations that I had with the next generation of researchers about how to define their lane, their passion, and how to continue to advance the field. Thank you, Ray, for sharing your key takeaways from the 2024 ASCO Quality Care Symposium and for leading a truly robust program this year.
Oh, thank you, Fumiko. This has been a labor of love, as you will find when you take on this responsibility for next year's meeting. This has been my pleasure.
Thank you so much. I'm really excited about the program that we're going to start planning in Chicago next year. Everyone listening can mark their calendars for October in Chicago. I really want to thank our listeners for your time today. You will find the links to the sessions and the abstracts that we discussed in the transcript of this episode. And if you value the insights that you hear on the ASCO Daily News Podcast, please take a moment to rate, review, and subscribe wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.